Hi, my name is Brandy. I'll be your student nurse today. I would like to do a head-to-toe assessment on you. It should take no longer than 30 minutes. We're doing an assessment just to make sure that everything is okay, okay? Can we first start by identifying who you are? Can you tell me your name and date of birth?
Armani McKay, October 17, 2004.
Okay. Do you have any allergies?
No.
And on a pain scale from 0 to 10, with 10 being the worst pain you ever felt and 0 being no pain, can you rate your pain for me today?
0.
Okay, if there's no pain. So we're gonna move on to your general appearance. No signs of distress just by looking at you. I'm looking at your facial expression and mood is appropriate for this assessment. And based on your responses, I would say that your speech is clear. Can you tell me where you are? Can you tell me where you are?
At home.
Can you tell me why you're here?
To get checked up.
Okay, can you tell me what year it is?
2020.
Okay, so based on my patient's response, I would say that she's alert, she's oriented to person, place, time, and situation, ANO times 4. Okay, so now I would like to assess your skin and your nails. So looking at your skin, it's appropriate to ethnicity and age. The skin color is even throughout. I don't see any lesions or wounds. Have you had any surgeries where you might have an incision? No, okay, so no incisions noted. I'm gonna palpate her skin for temperature. It is warm, dry, and intact. Now I'm gonna look at her nails. They're clean and pink. I'm gonna assess for capillary refill, and I will assess each finger. She has artificial nails, but we're gonna pretend that she don't. No ridges. Do this for me. No clubbing. No lesions, no ridges. And her capillary refill is 1 to 2 seconds, which is within normal ranges. So I'm gonna do her head and her face. Looking at her facial structures, they're symmetrical. Can I touch your head?
Mm-hmm.
I'm palpating her head. She has normal cephalic, no lesions, no signs of infestation. So then I'm gonna assess your cranial nerves. What I want you to do is close your eyes. I'm gonna touch your face with a cotton ball. Let me know if you feel it, okay? All you have to do is say yes.
Yes. Yes.
Okay, you can open your eyes now. Can I get you to clench your teeth? Clench them again? Okay. And then puff your cheeks. Smile. Wink through your forehead. Turn your head left or right. Up and down. All the way around. Okay. Now shrug your shoulders for me. Okay. So based on my assessment, cranial nerve 5 trigeminal, 7 facial, and 11 accessory are all intact. So then I'm gonna move to her eyes. Her eyes are symmetrical. I see no discharge or redness. Can you pull down on your bottom lids? Her conjunctiva is pink. Her sclera is white. Okay, I'm gonna use my pen light and I'm gonna assess for your pupils bilaterally. Quick second to grab my pen light. Okay, so looking at her pupils bilaterally, they're equal round, 3 millimeters in size, reactive to light. Follow my pen light, and they're accommodating. So then I'm gonna do my six cardinal glaze fields. Can you follow my pen light? Go over there. Okay. Cranial 3, which is oculomotor. Cranial nerve 4, which is trochlear, and cranial nerve 6, abductors are all intact. She has Perla, which means pupils are equal, round, reactive to light, and accommodating. Okay, so I'm gonna move to her ears. I'm looking at her ears bilaterally. No signs of discharge. I'm gonna whisper in your ear. Can you repeat after me?
Famous rabbit. Yellow taco.
Okay. Cranial nerve is intact. Cranial nerve 8 is intact, which is vestibular. Okay. Now I'm gonna move to her nose. Just by looking at her nose, I see no deformities. Can you look up for me? Her nose is symmetrical. And I see no drainage, no inflammation. And can you occlude one side of your nose? Breathe in and out. Okay, can you do the other side? And her nostrils are patent bilaterally. I'm gonna look at your mouth and throat. Can you say ah? Okay. Lips, tongues, and gums are mucous membranes are pink and moist and intact. No signs of lesions. Can you say ah? Stick your tongue out. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. Cranial nerve 9, which is the glossopharyngeal. Cranial nerve 10, which is vagus, and cranial nerve 12, hypoglossal. Yeah, cranial nerve is intact. I think I have to say that one. Okay, so now I'm gonna move on to your respiratory system. Can you stand up for me? And based off just looking at my patient, I don't see any signs of acute distress. Her breathing is unlabored. I'm gonna auscultate her anterior lungs. Usually this will be done skin to skin, but we're gonna keep her shirt on for this video. Breathe normally for me. Okay, now turn around for me, and I'm gonna do the same in the Z pattern. I'm gonna auscultate posteriorly. Breathe in and out for me. Okay, so then I'm gonna move on to the cardiovascular system, and I'm checking for edema. No edema present. I'm palpating her carotid one at a time. And then bilaterally radial pulses. You gotta see. Bilaterally dorsipedis. And then post-tibialis. Okay, rate and rhythm is equal plus 3. Okay. I'm gonna listen to your heart now, okay? And with the diaphragm, again, normally skin to skin, but we're gonna go above the shirt today. This is the aortic valve, pulmonic, Erb's point, tricuspid valve, and mitral valve. And S1, S2 are present. So with the bell of my stethoscope, I'm going to do the same again. Aortic, pulmonic, Erb's, tricuspid, and mitral. S3 and S4 are absent. Okay, I'm gonna move on to your gastrointestines, okay? Can you lay it back for me? Okay, and this will be done under the shirt too. I will look for color, contour, and her contour is flat, symmetrical, no signs of distension. I'm gonna auscultate her quadrant, starting with her right lower quadrant. So, right lower, right upper, left upper, and left lower. Okay. Vowel sounds are present in all 4 quadrants. I'm gonna palpate in the same manner. Right lower, right upper, left upper, left lower. Do you have any pain or tenderness with that? Okay, no pain or tenderness noted, no distension. Okay, so we're gonna move on to your musculoskeletal system. If you would like, would you please stand up for me? So I'm gonna assess a major and minor of her upper extremity. Her shape and contour is equal bilaterally for both extremities. Can you take your arm and just follow me? So bring it towards you, that's flexion. Bring it out, that's extension. And we're gonna do it with the wrist. Bring your wrist towards you, that's flexion. Bring it up to normal, that's extension. Can you take it back? That's hyperextension. And then twirl your fingers, your wrist. Okay, we're gonna have full range of motions of both her upper major and minor joints of her upper extremities. And then we're gonna assess your lower extremities. And her upper extremities are symmetrical bilaterally upper. And we're gonna move on to her lower extremities. Can you take your knee, which is your major joint, and bring it towards you? That's flexion. Bring it down. It's extension. We're gonna do the other side. Flexion, extension. Okay, we're gonna do your ankles, okay? Can you point towards the floor? That's plantar flexion. Bring it towards you. That's dorsiflexion. Inversion, eversion. Okay, let's do the other side. Plantar flexion, dorsiflexion, inversion, eversion. Okay, so her lower extremities are of the same contour, shape, and size. She has full range of motion and are symmetrical. Now I would like to assess the strength. Okay, can you bend your arms for me? Okay, I want you to bring your arms towards you. Okay, now push. Okay, good. Go have a seat for me. I want to do the bottom, your lower extremities. Okay, so push your legs out. Okay, bring them back towards you. Okay, she has strength equally bilaterally in her upper and lower extremities. Okay, I'm going to reassess you for pain. Are you having any pain today from a scale of 0 to 10, with 10 being the worst, 0 being no pain? 0 pain. I want to thank you for allowing me to do your assessment today. I'm going to give you your call light. I'm going to put your bed in the lowest locked position. Is there anything I can do for you before I leave? No? Okay. Hand hygiene. Thank you, and have a good day.